Howdy friends, your city manager Seth Sumner here. It is Thursday, May 7th, 2020, and I have your daily COVID-19 update. We'll start, of course, with the Tennessee Department of Health numbers, and looking at the data today, we do have an increase of 158 new COVID positive persons since the onset of this pandemic here in Tennessee. That brings us to over 14,096 positive cases. We have a wonderful number. This one keeps increasing, and we want to see that. 6,783 have fully recovered, and that we are looking at a specific period of time after the onset and since quarantine, and there are no ongoing symptoms in those persons is how they are able to list as recovered. That is an increase, a good number of 219 since yesterday. Now, we have had an increase of 45 Tennesseans now utilizing those hospital resources, needing acute care for their symptoms. That is, they need help either with ventilators or otherwise need to be monitored for help with their symptoms. They can't just stay quarantined at home and get it over those naturally. So 45 more Tennesseans in the hospital. That is a total of 1,266 Tennesseans now who have utilized hospital resources for acute care. Now, wonderful number. This continues to grow because we are focused on this across the state. You right now, if you have not been tested and you want to get tested, you're unsure about symptoms, maybe you have no symptoms, and you just want to have peace of mind and know whether you have COVID-19 or not. Because what we're finding out, especially in certain populations, is that folks have COVID-19, but they're asymptomatic. So if you want peace of mind, you want to be tested, free tests continue at our health department right here in McMinn County. You can go to the health department 9 a.m. until noon, Monday through Friday. It's a drive-through test. Go ahead and get that done and have that peace of mind, and so you'll know. So that is an increase of 9,227 Tennesseans getting tested since yesterday, and that is 236,328 total tested across the state of Tennessee. And you've seen that number skyrocket just over the last several days because we're seeing numbers like near 10,000 people being tested in a day. Tests are ample, they're out there, they're ready and waiting for you if you want that peace of mind, if you want to know, or especially if you are having symptoms, please do go get tested so we can be certain. Now, we do have 237 deaths in the state of Tennessee, and I'll have to look into and figure out what the -2 number is, whether two persons were not listed correctly or if that is supposed to be an increase, and maybe someone just hit the wrong key there. But it'd be wonderful to have 2 of those people back. We certainly want to be with those folks' families that have been adversely affected by this virus. 237 Tennesseans gone unnecessarily because of this virus is 237 Tennesseans too many. So we all have to do our part by staying apart. We still need to socially distance. We still need to make sure that we're not gathering in groups of more than 10. There are going to be some restrictions lifted this Friday for small group recreational activities such as kayaking, putt-putt, bowling, things of that nature where it's maybe 4 or 5 people. Still have to stay under 10. You can't have more than 10 people at any event, at any location, being in close contact with each other. But we are going to start also putting our tennis nets, some of those back up. We're looking at what other sports can we get back to that we've had to close as far as our recreation programs here in Athens. So we'll be looking to roll those out Friday and a few days afterwards as we feel safe and comfortable that that is the intent and that is the right thing to do while we're protecting our public health. Let's get over to our dashboard here with the Tennessee Department of Health still. We will look at Middle Tennessee, the Davidson, Nashville metro area still being the hardest hit, along with Shelby County, Memphis, and our friends over there. We're with you. We want you to know that whatever your needs are, you can call on us. We'll put you in contact with the best help that we can. We'll do whatever we can to help our friends in need right now. We've talked a lot about bringing United Way, coordinated charities, YMCA, Athens City Schools, all of the folks that are working and volunteering and donating to make sure that we're taking care of our friends and our family during this time. We've had a lot of folks impacted physically. Their health has been impacted. We've lost loved ones because of this virus. We have folks that are having some anxiety, some emotional issues that we need to be cognizant of. We need to be that friend. We need to be that family member. Reach out. Call somebody in your family or a friend that you haven't talked to or seen in several weeks. Call them today. Let them know you're thinking about them. That can make a great difference in their life right now as we continue to be isolated from each other because we love each other. We're together apart. Let's look at McMinn County. We have an increase of 1. We now have 108 COVID positive persons identified since the beginning of this pandemic. You can see where we are. We are still waiting on more data to roll in to see where we'll actually end up for the rest of these days. We hope that this trend downward continues. That's really what we've been after, and we thought we were going to get to back here in mid-late April. But then we've of course increased testing. More tests mean that unless COVID pandemic is actually over, we are going to have more positive people because we're testing more. We have more people wanting to get the test, and we're not just focusing on folks with symptoms now. Anybody can get that test. So we are going to continue to watch that and hopefully watch that wane in the days ahead so that we know that we're getting through this and maybe the surge is actually over and we can start breathing a little bit of relief and maybe feel comfortable about going out in public to some of these small group recreation places, some of these small businesses. We were able to get our haircuts for the first time in several weeks just yesterday, so that was a start of a good thing. I did get into a salon and watched as people were waiting outside in the car, getting called in. Everybody had masks on. There were, no more than 10 people in the building at one time. Everybody was doing what they're supposed to be doing, protecting each other's health, and that's what we want to continue to see. So let's scroll down. We've looked at all of those numbers already. To get into McMinn County, still looking at 3 deaths based on the Tennessee Department of Health data. We have 14 McMinn Countyans now fully recovered and 108 who have been diagnosed COVID positive, tested positive since the onset of this pandemic. Incredible number. Way to go, Athenians. Way to go. 1,755 have tested negative. That's certainly what we like to see and hear. You're getting out there, you're getting tested, and you don't have COVID-19. I love that. Good for you for getting out there and getting tested. Athenians and all McMinn Countyans, I'm so proud of what you've been doing during this whole time. Being responsible, loving your friends and neighbors, taking care of each other, and that's exactly what we do here. That is the spirit of the Friendly City. So great job. Let's keep it up because we're not through. We're not clear. COVID-19 is still a threat to your health, to my health. and we've got to protect each other during this time. So we're happy to see our businesses start opening up and being responsible, using their PPE, using face masks. If you need a face mask and you haven't been able to find one or make one, all you need is an easy cloth face mask. You know, it doesn't have to be a surgical mask or anything like that. You can make these at home with just some leftover cloth. If that's a problem, we got you covered. You can go to the McMinn County Health Department and get a face mask for free. No charge, just go drive up to the McMinn County Health Department and they'll give you a face mask while supplies last. And those are being provided free of charge across the entire state of Tennessee. Wonderful company. They're manufactured down in Cleveland, and they've produced over 300,000 of these face masks. You're saying, I'm a business owner, I can open back up, I'm going to be responsible, I'm going to take care of my staff, myself, I want to certainly protect my customers because I love my customers. But I need to know if folks have been sick. How do I know? How do I know if somebody's not coming in sick right now? You got to take that temperature. So, how do you go about that? The state of Tennessee, you go on tn.gov/governor/COVID-19. You go on that web page, and there you'll find a link where you can purchase a no-touch thermometer, an infrared thermometer that can take somebody's temperature without you having to touch them for $33. There is a small cost for that thermometer, but very little when you're thinking about peace of mind of knowing whether somebody is ill, and especially whether or not they have COVID-19. Whether they have any kind of illness or virus. We need to know that and look out for each other. So you can get those face masks for free at the health department. You can get tested for free at the health department. And you can get a low-cost, no-touch thermometer through a provider that is linked up with the state of Tennessee for only $33. So take advantage of those things. So very proud of what you've been doing out there, Athens. And now we will go ahead and reset. I do have a guest on the update today. Actually, I tell you what, I went ahead and closed it out. We'll cover that tomorrow. But there is some new data sets that are coming out through the University of Washington dashboard that we'll talk about in the days ahead. But I would like to welcome Mr. Jordan Curtis to the daily update. And Jordan is part of the Athens Economic Recovery Team, which encompasses really the entire council advisory committee and a few other people that are involved in business and economic development and things of that nature. And so, Jordan, if you wouldn't mind, tell us a little bit more about the Athens Economic Recovery Team.
Sure, thanks, Seth, and appreciate the opportunity to come on today. It's kind of funny, much like everything with this kind of pandemic, we had a Zoom meeting this morning, which you crashed and joined us there.
Yeah.
Our group,
a Zoom bombed you.
You Zoom bombed us. So our group got together this morning to kind of talk through some various details and communications and all that, and we kind of said, well, why doesn't somebody come on the show today? And so that's kind of how we got here. It's just, things have evolved so quickly, and that's kind of a common theme, and much like our task force. But really, our goal is to look at, there's so much information floating around right now from a variety of sources. And so what we hope to do, what our group hopes to do, is take the legitimate information that's kind of coming from the state and the governor and kind of boil that down and kind of digest it and then communicate it out in a concise way to Athenians and McMinn-Countians, and also kind of layer on some local flavor, some friendliness, and just kind of hit the highest points and really just kind of communicate what's most important right now. It's funny, you get a group together, everybody has opinions. That's just the way things are. And one of the common things from our conversation has been, what really can we do in addition to a lot of the state guidance? And I think the consensus, and again, not really trying to speak for everybody, but again, what we all kind of could agree on is that kind of a put on more steam. Things are going to be open, like Seth talked about, different activities are going to be allowed. But as folks are going to be out and about, what can we continue to do? Certainly, we need to just continue to block and tackle, wash hands. Let's don't get lazy in those habits that we've kind of developed. Let's continue to kind of push forward with those. Wash your hands for 20 seconds. We even joked about maybe putting a hit list together. People like to sing Happy Birthday or Itsy Bitsy Spider. If you're out there watching, maybe make a comment below of a song you'd like to sing while you wash your hands to make sure that you're hitting it for 20 seconds to kill all the germs. But again, that's really kind of what we hope to accomplish, is just to continue to encourage and communicate, because really it's all about kind of continuing to build these habits that are going to keep us safe and protect each other as we work through this pandemic. You'll notice in yesterday's DPA there was a kind of a graphic, an initial graphic from our group. You'll note at the bottom there is a survey for business owners to complete. So communication is a two-way street. We're going to communicate, and we want communication back. We are, and one of the purposes of our visit today on our Zoom meeting was, we hope to put out a really clean, concise website. Not really sure what that URL is going to be quite yet, but I know that's going to be pushed out on the official city social media so people can be aware of that. But we want really our friends and neighbors to have a legitimate, concise, clean place to go and look at the right information. And above all else, hey, look, like Seth has already said, we care about each other. Let's continue to be diligent, and let's approach working through this pandemic with a friendly attitude. And while we're dealing in a serious time right now, let's find the positive. Let's take care of each other. Let's sing a silly song while we wash our hands if it makes us smile for a few minutes. And let's try to find the bright spots where we can and continue to care about each other.
Wonderful.
Yeah.
I appreciate that, Jordan. Now, one of the questions that I'm sure a lot of folks watching right now have about these phases. We hear phase one come from the governor's office, coming from press releases, and then talking about different steps within phase one. So right now we've had several announcements that close contact businesses may reopen. We just heard that small group recreational activities may reopen, begin again. So we've had those, but all those are still considered phase one. We're not entering phase two. So one of the questions on the call this morning was, when will we know what phase two is? And unfortunately, we don't. This is something that the governor's office and the Unified Command are watching daily to see what the surveillance data is telling them. The surveillance data that we just showed you about the number of deaths, the number of positive tests, the number of recovered, and when they get comfortable that they're starting to see that wane again, that those numbers are decreasing, then it may be an opportunity for them to start planning. And by start planning, what we have to recognize is none of us have been here before. Not ever. Not anything compares to the way that we're having to move and react and think and what we do to protect. It's a lot of unknowns right now, but to protect our people. So thinking about those phases, and I know that's difficult because we're used to, well, you said there's phase one, so when's 2 and 3, and is that going to be June or July? Well, we don't know. But that is a decision that's made by the governor, and Unified Command and the Economic Recovery Group is putting these out. and they're having to put these announcements out, within hours. So there's not several days that go by and nothing's happening. They're putting these things together and ready when the data is showing that it looks safe. I know there were a few other things that you may want to consider sharing on that phone call that we're looking forward to, and some of the questions that we kind of walked through. I know folks have got some anxiety because we're used to things being planned and scheduled, and that's not how this is happening. It can't, unfortunately.
Well, that's exactly right. And again, trying to be realistic but also positive. And I was thinking about this as you were going over some of the information set, but I think if we're going to compare this to a prior event, we tend to look at the 1918 Spanish flu pandemic.
Right.
And I think that our great advantage as we sit here today compared to a little over 100 years ago is our capacity to gather data so much quicker. Because I really feel like, and again, I'm kind of editorializing a little bit in my own personal opinion. I think kind of one of the keys we have is gathering as much data as possible. The tests, at the point in time that reliable antibody test is really available. So I think so much of the answers to those questions rely on gathering that pertinent data, and that's going to take time. It's almost like the answer to any question right now is, well, maybe. It's kind of where we find ourselves.
Yeah. And that causes anxiety, and that's not necessarily what we want to hear. We want the answer, and somebody give us the answer.
Sure.
And it's not that clear cut because this is new and different. Really, truthfully, by the minute, things are changing, and so I really appreciate the effort and all volunteers, people that are that have day jobs and family life and all of those things, taking a few extra moments, putting your thought into this economic recovery. What does it look like? How can we add that friendly city approach to really reiterating what is being put out by the governor as guidelines, as best practices, as what we need to be doing to protect each other. And it's been unfortunate to me to see that some of our friends and neighbors aren't taking it seriously. They're not wearing the face masks when they're going into the grocery store. They're maybe not following the best hygiene practices, and it's it's one thing to disregard your own health, but what we know is you're disregarding the health of others and people you likely care about, and so it's unfortunate to see that attitude occurring within some of our population, because we love everybody. We want to protect all people and make sure that we're not transferring this thing on to somebody else that may be in a position with a weakened immune system where they die from this. I'm not going to be that person. That's part of what I take as part of this Tennessee pledge. And so that leads me to another question for you, Jordan, is in consideration of the Tennessee pledge, how do you read that? What does that mean to you?
Well, it's funny. We were kind of kicking that around on the call earlier today, and I think again, trying to find a positive spin. And one of our committee members, Whitney Campbell Coe, mentioned let's try to approach everybody like we're thinking about them as our grandmother.
Yeah, that's right.
So I think that's a great East Tennessee, Athens, Tennessee way of looking at things. We're thinking about keeping our grandmothers healthy and safe. So let's go about our day with our hygiene and continue to mitigate this virus, thinking about the health and well-being of our lovely grandmothers.
That's right. I love that thought. Everybody loves grandma, and just treat everybody else like they're your grandma. That's how you want to protect them. You want to love them. You want to take care of them.
And let's take that past this pandemic. Let's try to embody that attitude all the time. If you get a little angry, let's say, well, how would I treat this if I was a little bit angry at my grandmother? Maybe that'll teach us to be a little kinder to one another.
Probably wouldn't open my mouth.
That's exactly right. I know. I wouldn't either.
Probably wouldn't say anything. Wonderful. Well, thank you for being with us today, taking some time away from your own family
Sure.
to be here and share this message with our folks. And I deeply appreciate what you and all of our friends on the Economic Recovery Team are doing right now. And it's really wonderful. I was interviewed earlier today on a podcast dealing with innovation and technology, and you know, one thing that came out of that is you know, talking about innovation. This is an opportunity for us to be innovative, to have new and different approaches to how we're treating each other and how we're taking care of each other. And so having to move minute to minute in different ways in this pandemic has been, it's been exhausting and exhilarating at the same time. But I really do appreciate what the whole team is putting together, and still, I'd love to see this website you talked about. It would be a good landing page, I think, for our businesses and all of our citizens out there to go to know what everybody should be doing and paying attention to. And let's hold each other accountable. I'm going to be my brother's keeper, and so that's part of what I read into that Tennessee pledge is. The governor, our state government, it isn't saying you must do this, you will do this. It's please. Let's think about each other as we would our grandmother, and let's take care of each other. And that's just because it's the right thing to do. We're adults, we're humans, we live in this world together, and we're just going to do what's right. And here's the guidelines. Here's some help to help you get there. And that's what this Tennessee Pledge is about. So go on tn.gov and make sure you look at that. I told you about those resources if you're in need. If you are in need of anything, if you're out of work right now, if you need help getting to, getting rent, getting food, we have those resources available right here in McMinn County. We also have help through state. You can go on tn.gov for some of those. But also call the United Way. Look to calling coordinated charities. There are resources here because we're volunteering, we're donating, we're sharing because we love you. And we're going to take care of our friends and our neighbors, look out for each other, and we're going to do what's right because that's what we're being called to do right now. So, is there any other message you might want to share with anybody before we sign off for today?
No, I'll just say, to kind of underscore what you said, Seth, if there's somebody out there that you're thinking about that you haven't seen in a while or are concerned about, pick up the phone, call them, check in on them. Even though we're being distanced, let's stay connected and take care of the people that we're concerned about.
Absolutely. Thank you for that, Jordan, and thank you for being with us.
Thank you very much.
Ladies and gentlemen, I wish you well. Please get tested. Take advantage of these resources. If you are in need, call us here at the Friendly City if we can be of any service to you. We are here to serve you, and we're going to continue keeping this city together and moving it forward. This Friendly City will keep moving forward throughout this pandemic and into the future. May God bless you, and may God bless Athens.